All right, let's go ahead and get started. Thank you so much for coming this morning. Our session is on strengthening menstrual health and hygiene monitoring, specifically building global and national data for evidence-based action and investment so that we can really see an improvement for people who menstruate around the world. So we're going to have 4 presentations to start us off. First, we're going to hear from the Global MHH Monitoring Group. We have a couple folks online, and they're going to go through the global priority indicators for monitoring girls' menstrual health and hygiene. And then we'll hear from the Joint Monitoring Program, and giving an overview of progress on menstrual health monitoring, looking at it from a global level. And then we'll dive a little deeper. UNICEF and WaterAid have a presentation with country examples on improving monitoring and using those data to actually create change. And then we're going to dive even deeper. We have Swiss Water and Sanitation Consortium here. They're going to give us some project level examples from a number of countries on introducing these new recommended indicators and collecting data. We'll have some Q&A, and then we have a breakout session where you'll get to discuss with each other, share some experiences, share your thoughts, and then we'll share back all together. So with that, here are our objectives today. By the time that you leave, we hope you have a good understanding of the globally recommended indicators for MHH monitoring, that you're familiar with some of the emerging data and some of the associated challenges with those data. You're aware of available resources, and you're inspired by the examples that we hear today. And then lastly, that you have a chance to reflect on some of the key actions that are needed to improve MHH monitoring nationally and therefore globally as well. So I'll hand over to Marnie and Therese, who are online. Can you hear us, Marnie?
Yep, I can hear you, and I actually recognize the back of some heads in the room, which is very exciting. Thank you for beaming me in. I'm sorry I'm not there in person, which was the goal, but it's exciting to be participating even from New York City. So I know we have a really tight schedule. The only thing I'll add to what Christy just said is I love that she said, we hope you'll be inspired, because I know all of us working on the core indicators really hope that folks in countries around the world will start trying out even just 1 or 2 of them, and we start to have better data to compare, to monitor, to see what's happening, and to make a case for MHH in the post-SDG framework. So just to move along, what I'm going to do today is just, many of you may be familiar with our priority indicators, but in case folks aren't, we just wanted to go through them to explain a little bit about what they include, what they don't include, and then flag some resources for those of you who want to get started in your own programs or countries. So next slide, please. Next slide. So we can have it all pop up, Christy. Okay, so I'll give you one. So what is this global indicator shortlist? Well, it was an effort to really help to raise awareness about MHH and give countries around the world a way to assess and monitor progress. As everybody knows at UNC, I know data is really important. And what we measure is not only what we pay attention to, but it's what gets done and what creates a need for accountability. So by developing these indicators, which were very much a global effort, and I should have said this on slide 1, you can see all of the core institutions who were involved, the JMP, UNICEF, WHO, various UN agencies and global experts worked together during COVID online in a very collaborative effort to come up with these indicators. So they are a way to provide targets to encourage action and also to sort of hold people to account to do what they say they're going to do or are striving to do. It helps us to track progress. We know that policies and programs are starting to show up in different countries, which is wonderful, but we want to be able to see how that's going. It creates real solid data to push for action and real investment, which I think many of us feel continues to really be lacking in relation to what we could be doing and given how important menstrual health and hygiene are. and it enables us to monitor progress across the priority domains, which I'll speak about in a minute, and to compare across countries and over time. One thing just to flag there in the small font is reference to an article that many of us put out, which just was the result of an exercise trying to identify where MHH really fell within the SDGs. And ultimately, we decided it was relevant across all 17, which I think is really saying something about its importance. Okay, next slide, please. You can actually show both. Super. So we thought it's important to really be clear about what this is and what this isn't, because so many people are eager, I think, to have measurement tools to use to really be able to report out on what they're doing and how they're doing. So it is a short list. It may feel like a lot of indicators in a world that has innumerable indicators, but it really for us was the priority list we could come up with. Not a comprehensive list because we thought there's even less chance folks will start using it if we had too many. So it's a short list to help countries get started. The focus is adolescent girls, not because we don't think women are important and others who menstruate, but that's really where the evidence was to enable us to come up with solid initial indicators and measures. We do think many of them can be adapted and tested for adult women, and we encourage folks to do that. It's not detailed guidance on how to do data collection. Our sense and feeling is that others know how to do that or can do that better. We just wanted to give everybody the MHH indicators and measures go about doing the data collection. And we did our very best, given this was a global collaboration, to make the indicators and monitoring tools as aligned as possible with what is already out there for national monitoring, such as JMP, DHS, PICS. We couldn't do it perfectly, but we really do recognize the burden on countries and programs, and we wanted to be as aligned as we could. It is not a fully validated final list. Many of them require testing and for sure adaptation to new contexts, which I will speak about when I get towards the end, when I get into resources. Next slide, please. And if you could actually do do it again. Great, thank you. So table 1 is in the guidance note, which is free online, and I'll get to a QR code at the end. It provides an overview of all of the recommended indicators. They are grouped across 7 domains, as you can see down the side of the slide. These domains we put together after much discussion, looking at all the existing definitions from recent years of MHM, menstrual health and hygiene. The first 5 monitor key requirements for menstrual health, such as having access to materials, sufficient facilities, and so on. And then the final 2 capture the impacts of menstrual health and hygiene on girls' actual lives and track the existence of policies and budget lines to support them. The indicators are primarily broken into individual level and school level, as you can see on the right. And we make that really clear throughout the guidance note as you're reading through. So one thing I would just flag is that we really tried to go a bit beyond where the world was in terms of the focus on facilities and materials, and include things like discomforts and disorders and other aspects we thought were quite relevant and we thought were a priority. Okay, next slide. I'm mindful that I don't have that much time. You could go, great. Perfect. Thank you, Chris. So now I'm just going to very quickly, I don't want to spend a lot of time because you can all peruse this on your own, go through the pages of the guidance note. So you can see it is laid out exactly the same, the entire guidance note. You see the same structure for the indicator, there's a purpose, survey question, and then evidence and considerations. So we hope that this will make it that much easier for folks to take up. Next slide, please. So again, this is just pulling into focus, specifically what it looks like when you read through. Again, I'm mindful that we have a lot to get through today. So just to sort of highlight again, the indicator and then its purpose. Next slide. The domain also, as you can see, is laid out in terms of the evidence and considerations. Next slide. Sorry, I'm one ahead of myself. Just to try and help people understand the rationale behind what we came up with. Next slide, please. Okay, so just again emphasizing a little bit what I did earlier. Without data, the indicators cannot come alive, can't do what they're intended to do. We've been working to disseminate them. We worked with 3 exemplar countries, Bangladesh, Philippines, and Kenya, on developing these, and now we have many more countries we've been engaged with, which others will talk about. The mixed menstrual health module, which you're going to hear about today, will also provide some data. We're as aligned as possible, I think, with that. I do want to do a little promotion, although I know they will do this themselves, but there is, I know, some funding from the Bill and Melinda Gates Foundation to support the menstrual health module for countries that are doing mix. We really hope that folks will follow and do that. The one thing about mix that we're trying to move beyond is that it is primarily those who are 15 and older, and our indicators ideally capture the experiences of younger girls, those in sort of late primary, early secondary school, and we don't want those girls to be missed, and that's a bit unusual. So we're hoping folks use our indicators and find out what's happening with younger girls who we know are getting their periods and trying to manage them in late primary school, and who are younger than 15. Testing is obviously beneficial to make sure that the indicators are validated and ready to be sort of promoted in relation to the post-SDG agenda. Next slide, please. I just want to quickly, just 2 more slides, talk about the types of resources we have out there for folks who do want to get started, and our whole group is happy to connect with anyone interested. So as I mentioned, and there's a website with all of this, which the QR code will be in a minute. There is the original priority list of indicators, which has the full technical guidance, which I was just showing you pictures of. The full guidance is translated into English, Spanish, French, Arabic, and Bengali. There is a summary guidance version. We didn't have the funding to do the entire guidance. It's a bit long, but there is a short version of the guidance in Portuguese, Mandarin, Russian, and Bahasa Indonesia. And then we also have a document posted on that page around integrating MHH indicators into research and program monitoring for those who might want to do that. Next slide, please. We also spent a fair amount of time developing training materials. These are not training materials to teach folks, obviously, how to do data collection. That's other people know how to do that and do that better. What they are is a training deck, and they're really big, which is why we split it into 2. So if you're interested in taking these up and using the training, please make sure to go for both of them. One is focused on the individual level indicators, the other is focused on the school level indicators. And on our website, because we had to contend with the Columbia University website, you will see the PDFs posted, so you can get the full training decks in PDF format, but there's also a link you can follow to download the PowerPoints, because we know people may want to play with it, cut out sections, just focus in on the bits they need. So just know both options are available. And then final slide. So here's the QR code to the website for folks who are interested. All of us are available. And there's other members of the core group who are also available. If there's any questions or interest, we are about to collectively focus in even more on trying to find countries who may want to partner with us if we're able to identify funding to really do more work on this issue. So anyone who's interested, please reach out to any of the 3 of us. And thank you so much for allowing me to join from far away today.
Great. Sorry for the technical difficulties here. With that, I'd love to invite Tom Slaymaker from WHO UNICEF Joint Monitoring Program to present progress on global monitoring of MH.
Okay, thanks, Christy, and hello everyone. I'm Tom Slaymaker. I manage the UNICEF side of the JMP. My colleague Rick, who manages the WHO side, is here, and Christy's been working with us for many years on this topic. What I'm going to do is just give an overview of what the JMP has been up to and where you can find information on MH, and to show how that has evolved over the last few years. So we started working on this at the beginning of the SDG period. We've tried a few things. We've refined our recommendations, and we're continuing to compile and analyse the data in our reports. So, firstly, why does JMP monitor menstrual health? This is a question that comes up. So menstrual health was identified as a priority at the start of the SDG period. We have our SDG goals and targets that you'll be familiar with, not just SDG 6, but also 1 and 4 and 3, all of which have elements related to WASH, but none of those targets had an explicit reference to MH. So what we did get was this reference under SDG 6.2 to paying special attention to the needs of women and girls, and we've used that as a hook to look at this issue, and we've done it in households, but also in schools and healthcare facilities. So we've interpreted this broadly, and it's allowed us to do quite a lot of work over the years. We started developing core questions at the beginning of the SDG period. We did that for households, but also for schools and for healthcare facilities. And you'll see in those core question documents that there are references to MH in all three. And then we've gradually been compiling the data. So it was an emerging theme, I think, in our household report in 2019. And then it became a full chapter in our 2021 report. And by 2023, we had data for 53 countries. And just recently, last year, in fact this year, we released our most recent update on WASH in schools, which has a special focus on MH. And there are a number of things that have contributed to that. One of the things has been within UNICEF having a big push on monitoring MH and trying to support governments to collect data at a national level. Another is the priority indicators that Marnie was talking about. We also have a priority list of gender indicators, which cross-references the indicators on MH, which is very important. And I'm going to talk briefly at the end about the new Mix 7 module on MH. So very briefly, if we look at school, healthcare facilities, schools and households importantly. So when it comes to monitoring MH in healthcare facilities, this has always been part of our definition of basic sanitation services in healthcare facilities. So it was there at the start. If you look at the definition, you see that there are 6 elements. It's about the proportion of healthcare facilities with improved and usable sanitation facilities, at least 1 toilet dedicated for staff, at least 1 sex-separated toilet, which is relevant, and there's an explicit reference there with menstrual hygiene facilities, and then at least 1 toilet accessible for users with limited mobility. So these 6 elements that we're looking for when we're monitoring sanitation in healthcare facilities, and you'll see that this data has been compiled in each of our updates on WASH in healthcare facilities. Our most recent one came out 2 weeks ago, has a special focus on primary healthcare, and in that report you can see the data that we have on MH. Relatively few countries have information on this element. I think there are about 43 countries that had information on all 6 of those elements, including MH. And if you look at those, you can see that MH is actually the limiting factor for basic sanitation in healthcare facilities for about a third of them. Okay? In some cases, it's limited mobility. In other cases, it's other criteria, but it's very often the limiting factor. And then in the countries where we have information here on healthcare facilities with improved sanitation, with menstrual hygiene facilities, you can also see that there are quite big differences in this case between hospitals and non-hospitals. So here you can see Iran, for example, nearly 3/4 of the hospitals have menstrual hygiene facilities, but only about 20% of the non-hospitals. And most of the countries follow that pattern, but there are a couple where actually it's the non-hospitals which are more likely to have these facilities. So where we have the data at the national level, where it's standardised and comparable across countries, then we feature it in our reports and we try to get a conversation going about what it all means. We take the same approach for schools. I think you'll be familiar with the JMP ladders for washing schools, but you'll also may be aware that there's this sort of advanced rung at the top which remains undefined. We mainly focus on monitoring up to the basic service level, which is what we need for SDG monitoring, but we've always had this idea of an advanced service, and there we suggested some possible topics that could be included, and menstrual hygiene facilities was one of them. At the start of the SDG period, we did propose a couple of indicators. There weren't any validated indicators available at that time, but we put them in our guidance, and they have been used and they have been tested. And then more recently, we've had the priority indicator guidance, which Marnie was talking about, and so we've been focusing particularly on those in our updates. So the report that came out earlier this year, which had a special focus on menstrual health in schools, really drilled down on those priority indicators. We used it as a framework for looking at the data availability on menstrual health in schools. And we looked at all of those different topics which Marnie listed earlier. And the top line finding is that there's quite a lot of data on materials and facilities, a little bit of data on knowledge, much less data on discomfort and disorders, and a supportive social environment, and especially the MH impact. But because we have data for about 30 countries, and some of those countries are quite large countries covering a large proportion of the global population, we did generate some preliminary ballpark estimates for certain regions and also globally. So you can see we estimated around 2 out of 5 schools providing menstrual health education, for example, around 1 in 3 having bins for menstrual waste in girls' toilets. We have quite a lot of data for Central and Southern Asia and for Sub-Saharan Africa compared with other regions of the world. So what we've tried to do with this, if you look in the report, you'll see a table. You have all of the indicators. You can see how many countries do we have these kinds of indicators, and then we've got some analysis of the data that are available. But one of the key takeaways here is that these data are really messy and they're not harmonized or standardized. And we've tried to highlight that in the report. There's a lot of work to do in order to be able to look at these indicators in a standardized way across countries. So in our report, we're just drawing attention to that. We're trying to encourage a discussion about how we can move these indicators forward. The one that's highlighted there is the one which is part of the definition of a basic sanitation service in schools, which includes single-sex and usable, which is referenced in the priority list that Marnie mentioned, and that's the one for which we have the most data at the moment. So about 165 countries globally. Lastly, but not least, progress monitoring MH in households. Again, we had some indicators in that core document at the start of the SDG period. Those have been used quite widely: private place to wash and change, use of menstrual hygiene materials, and exclusion from activities during menstruation. And as those have been collected at a national level, particularly through household surveys, where there is a questionnaire for women and girls aged 15 to 49, we have been compiling those data and including them in our global updates. So as I mentioned, there was an MH chapter in 2021, and again in 2023. And in that one, in 2023, we highlighted we now have data, standardized, harmonized data on these indicators for 53 countries, which is really quite a big step forward compared with where we were at the start of the SDG period. This is 53 countries with data on at least one of these menstrual health indicators. And you will see in a minute that we have far more data for some of them than for others. But these have been the 4 core indicators that we've been working with over the last few years. So use of materials, a private place to wash and change, participation in school, work and social activities, and also knowledge about menstruation before first period. And in the report from 2023, this is the progress update for wash and households. You can see all the countries for which we have data and the coverage of these 4 core indicators. You can see generally that use of menstrual materials is quite high. Private place to wash and change is a little bit lower, and participation during menstruation is significantly lower in some countries. We have only 2 countries which have nationally representative data that we're aware of on awareness of menstruation before first period. I think those were Egypt and Bangladesh, and you can see very big differences in awareness. But generally, you will see that this sort of high prevalence suggests that the indicators are perhaps not sensitive enough in terms of capturing the issue. So, in the meantime, we have been taking into account all the lessons from using these indicators, collecting the data, analysing the data, the recommendations that have come from different groups. We had a global definition of menstrual health, an expanded definition that was published in 2021, which was very helpful. We've had the priority list of indicators that Marnie spoke about, which sets out all of those priority indicators for individuals and also for schools. We have the recommendations on priority gender indicators as well, and there are various other studies. So, for example, there was a USAID study on washing the workplace, which had some important recommendations as well. So we put all of those materials together. We had a sort of expert review of what could and should go into the next round of household surveys. And this is our new expanded list. And you'll see that there are some important differences. So on materials, it's now about reporting having enough materials, so the emphasis on sufficiency, which was not there before. For facilities, it's about a private place to change. So we've separated washing and changing because that was causing some confusion. We have knowledge about menstruation before first period, which remains a priority indicator, and we don't have much information on that. And then we have these new ones on discomfort disorders, supportive environment, and MH impacts, which were not there before. So we're able to reduce the menstruation-related pain during last period, would feel comfortable seeking help for menstrual problems from a healthcare provider, and did not have trouble participating in school, work, or paid activities. And so we're trying to disaggregate these activities as well. So it's not participation in all of these activities, but participation in those activities which are relevant for the different groups. So, as Marnie mentioned, we have a new module. This has been developed, and there's a long process behind it in formulating the questionnaires, the response categories, the way in which those data should be analysed and tabulated and included in Mix 7 survey reports. All of those materials are now available on the website. The module is being rolled out. We have quite a large number of countries which have expressed an interest and confirmed that they would like to include this, but it remains complementary. So that means that it will only be included in the survey if national stakeholders are asking for it. So that means if you're interested to pursue this topic and you're part of these discussions at a national level about which modules are included and which ones are not included, then it's really important to speak up and to support the inclusion of these complementary modules. All the data is online. If you're not familiar with the country files, you can dig into those. This is the example of the country file for wash in households, which has a separate tab on menstrual health, so you can see the breakdown of all of the information that we're able to extract on each of these indicators for each country for which we have data. So you can go and find the country you're interested in and look at the results from that survey. And we'll be updating the data tab on menstrual health in households to incorporate all of these new indicators going forward. And the rest of the resources are there on that last slide in case you'd like to follow.
Thank you so much, Tom. Great to get a global overview before we dive deeper into some country examples. So our speakers for the next presentation, one is online and one is here in person. Mariah, if you want to come up here from UNICEF, and then Therese from WaterAid is online. Therese, can you hear us?
Hi everyone, yes. Can you hear me?
Yes.
Fabulous.
So, hi everyone. So we have a joint presentation between WaterAid and UNICEF on using these indicators in a country context, and Therese is going to start us off, and then I'm going to jump in halfway.
Okay, thanks very much, Mariah. So As Tom shared there, it's really important that we have more harmonization and standardization of monitoring menstrual health and hygiene, particularly when we're trying to look at things at a national or global level. Within specific programs and so on, there may be, and research, there could be very specific other needs for monitoring. But in order to sort of compare between different countries or even within countries or over time, we need to look at this standardized indicators. So I'm going to share briefly the collective learning from the Menstrual Health and Hygiene Monitoring Group and our collaboration with UNICEF and country stakeholders across 12 countries that we've been working with for uptake of these priority indicators. Next slide, please. So starting back in 2021, when we were developing these priority indicators, the monitoring group was working with 3 exemplar countries. That was Bangladesh, Philippines, and Kenya. And they were selected because they were already, governments were championing menstrual health, and there was some national level monitoring initiative. So working with those 3 countries really informed the development of this priority list of indicators and really helped us to understand what indicators linked to country priorities and what indicators were feasible for governments to collect at a national level. Since the indicators were developed, we've continued our engagement with those 3 countries to look at how they can now expand on the monitoring that they've been doing and align to the the priority indicators more. We've also expanded beyond those 3 countries. So in the last year, WaterAid and UNICEF have been collaborating to engage with stakeholders in Pakistan, Nigeria, Jordan, and Egypt. WaterAid also supported a similar engagement with Nepal, and Save the Children have been working with stakeholders in 4 more countries: Indonesia, El Salvador, Mexico, and Senegal. So we've managed to engage with countries across quite a number of geographic regions. Next slide, please. So from this, we've sort of arrived at a set of activities which I think can be helpful for other countries, other stakeholders who would like to get started with something similar in other countries. So to start with, it's really about understanding the stakeholders in country in relation to menstrual health and hygiene. Who are the leading organizations, ministries, stakeholders, but also ensuring that we really have engagement from across all the relevant sectors. And sometimes there's a sector leading, it could be WASH, could be education, could be health, but it's really important to have this comprehensive set of indicators integrated to ensure that all are engaged. Another really critical stakeholder is technical working groups or MHH platforms and alliances, because they really bring together a diverse range of stakeholders. Once we know who needs to be engaged, then it's really about having that country leadership of the process. That could be the relevant ministry, also supported by development partners to coordinate the consultation process. And that's really important because the end goal is for this integration into systems reflecting country priorities. So it's essential that the relevant government ministries are engaged and leading this process, but supported by development partners as well. After that, we've had an initial consultation convening of these stakeholders, but really it's a starting point to introduce the indicators, get a snapshot of where things currently are, and discuss how they can engage in this process. That's followed by a context analysis, but this is like from a very specific monitoring angle. So not everything and everything about menstrual health and hygiene, but really to understand what are the monitoring systems, what's currently being monitored, what research, what opportunities are there to integrate indicators, and how is the decision making made around monitoring, as well as the current policies and strategies and so on. A final workshop brings those stakeholders together to review and validate what's been found, but also to prioritize what indicators could be taken forward and what the next step should be, with action planning and follow-on support identified. Next slide. So very, very briefly, I'm just going to give a snapshot of two countries, Bangladesh and Nigeria. In Bangladesh, what we found is there's very comprehensive data from periodic surveys covering most of the indicators, but there's nothing integrated into regular monitoring systems like the education MIS. The real opportunity in Bangladesh has been the national MHH strategy, which also includes a monitoring component, and work done to develop costed plan. Bangladesh is in the next mixed round. UNICEF is leading a washing institutions survey, and there's a research study with adolescent girls. All of these are incorporating some of the indicators. Next slide. And when Bangladesh stakeholders met to prioritize, you can see here they actually prioritized indicators from across all of the domains. However, the next step really here is to look at what now is the decision-making process by which these can be taken forward. So it's a journey. Going to Nigeria. So in Nigeria as well, there's a lot of data already collected and some really excellent existing processes in place where these indicators can be collected. So there's a very comprehensive WASH norms survey, which looks at the status of WASH in schools, institutions, households. And there is also in Nigeria a strong technical working group and a draft strategic framework. So all of these create spaces where the indicators can be incorporated. And that's why it's really critical to get these opportunities identified and interact with them in a timely way. Next slide. So you see for Nigeria, these were the priorities identified. And what's not come up as a priority is the discomforts and disorders domain. And I think Tom also identified that that's the one where one of the domains where we have least information. And there could be some reasons behind that, not just for Nigeria, but globally, in that the health sector perhaps hasn't been as much a part of these MHH conversations. But also some things are easier to monitor. So that's something where we may need further advocacy. But handing back to Mariah for some of those overarching lessons.
Thank you so much, Therese. And just to say, I was in Senegal last week and I met with some colleagues from Nigeria, and we were discussing a global partnership African-based partnership, 8 countries. And in the partnership, we made one of these impact indicators for MHH compulsory. So Nigeria will have to collect data in order to receive money for next year. So that's another way that we could introduce these indicators. Moving on to the common enablers that we've seen while looking at the 12 countries and more closely at the 4 countries together with WaterAid. What are the common enablers that help us drive MHH monitoring? We've seen in the last 10 years, I think 10 years ago was the first MH Day, and now we've seen the climate for MH is changing. We can more openly talk about it. It's a topic that we can discuss. There's also more stakeholder interest and commitment towards expanding the work on menstrual health and hygiene. More governments have MH policies in place, or a working group, a coordinating body. And girls also have voiced that they require more information on menstrual health. And you see the big gap right now is girls don't know about having their period before they get it. So girls also speak up. Social media is a great way, and we see that girls want to know more about menstrual health. The other thing, in the context of inflation, we do see that prices are going up, including the prices of menstrual products, and more, even in the US and the UK, we see issues like period poverty. And if we don't monitor access to materials, we could see that with pretty good access to materials, we could see a drop, but we need to be able to monitor to see the trends over time. And then there's a growing market for femtech. So we have all these new apps around menstrual health, and it's a really great way to also make monitoring easier, but also to share information. There's also, of course, some barriers. Still, it's a taboo topic, making monitoring difficult. Sometimes you're not able to use the word menstruation. You have to use female hygiene. I think that was the case in Jordan when we did this work together. But also enumerators, people who are asking the question should be comfortable asking them. So I think that is a key there that we need to pay attention to. And every sector has their own monitoring system. You saw in the country examples, WASH, health, gender, education, so many sectors, and then of course you have planning sectors. So each of them have their own monitoring systems. How do we bring these together? How can we share data between sectors and also make data more transparent and make it useful? Menstrual health is still not fully embedded in policy and strategy. Funding remains an issue, including the human resources, also to analyze the data and then to be able to use the data as well. And data is not always available to actually be used. Sometimes it's collected, but then not shared further. Now, the lessons that we have learned from the experience to date in these 12 countries, and more specifically in the 4, it's really important that we don't forget the people behind the data. It's only useful when we help to capture a true experience, but also we need to collect data responsibly. Girls also need to know what happens to the information that they are sharing. We have to bring together the right stakeholders at the right time. We need to make sure that roles are clarified from the start. Who does what, who shares with what, who leads on what, and who supports what, etc. Because it's such a cross-sectoral area of work. Then we need to understand better how this monitoring system works. Who collects what data, where does it go, where does it come from, who is analyzing it, who is using it, all of that. So we need to shine a light on the monitoring systems, and sometimes these are multiple systems that we have to use. Then the stigma I touched upon before is very important. And then you may think, oh, 21 indicators just for menstrual health. That is a lot. And these are the priority indicators. Are you kidding me? So the idea is start small, but grow as you see an opportunity there. We don't have to focus on all the 21 indicators. Let's use the one that are the most useful for the country context, that girls want to know, that policymakers want to know, and that you could actually use in your policy, in your planning, but also in directing finance to the right direction. And I think that's also very clear from the JNP discussion, where we actually have almost 100% access to menstrual materials, so maybe that's the wrong question to ask. And sufficiency should be the question to ask, right? So these are the things we need to look at. So we don't need to do all 20. Then can we use existing processes? Mix is a great example, and can that feed then into the JNP report that they work on really hard every year? Use the policy processes, for example, school health and nutrition programming. I know that WHO also has their list of questionnaires, and there are a few MH indicators in there as well. So can we use other monitoring systems to collect data. Making sure we scale up only as we have the capacity to actually collect the data, analyze the data, and use it. And the last but not least, I think if you don't have a national government that is keen to monitor MH, you could look at the local level or look at other champions. For example, the 3-star approach, which is kind of an incentive or competition scheme for school wash. In many countries has started to include questions on menstrual health and hygiene, and it's a great way to get data. Okay, so there's multiple pathways. This is my last slide, so that's great. So there's multiple pathways to make sure that we can use data to strengthen MH services and programs. The first one, advances in national policy environment, making sure that we have a supportive organizational culture, process, and system in place. We need to strengthen organizations, and we need to coordinate to increase the capacity for monitoring, production, and data interpretation. We need to target advocacy and communication for the take-up of the findings of the MH data to then inform policy and programming. We also need to have the right data and disaggregate data to improve the specific targeting. Who do we need to reach with what type of intervention? We need to communicate data to ensure that it's used, and then of course access to quality MH program and services can help, is needed. Sorry, I'll start again. So we need better quality data and then in order to improve the quality of MH data, MH programming and services. Okay, that's it so much. Thank you so much from my side, and I'll hand it back to Christy.
Thank you very much, Maraya and Therese. Wonderful to hear about barriers and opportunities at the national level. And thank you for flagging that we don't need to put all 21 into every monitoring system. That's promising. And on that note, we're going to hear an example of selecting from that larger list with Ramesh from Swiss Water and Sanitation Consortium. Come on up.
Thank you. Good morning, and welcome to this presentation. My presentation is regarding use of priority indicators for MSH in Swiss Water and Sanitation Consortium projects. So I will start what is Swiss Water and Sanitation Consortium basically, very briefly. The Swiss Water and Sanitation Consortium is a WASP platform created by 8 Swiss NGOs in 2011. Later on, 2 partners they also joined. They were called as thematic partners. So they are 10 altogether. And we are working in 12 different countries across 3 regions: West Africa, East Africa, and Southeast Asia. And main focus is on institutional wash, both covering schools as well as healthcare facilities, but we do also serve the communities based on the demand. So with that, concerning baseline study, basically we have now started new phase 4. Recently, and then we conducted baseline survey, and we used some 4 indicators for school level, priority indicators. That was explained just before. So the number 2 is basically regarding menstrual materials, availability of menstrual material in schools. Number 5 indicator is basically basic service level in terms of sanitation facilities in schools. And number 7 is private space with availability of water and soap. And number 11 is basically the MS education in school, starting at age of 9. So these 4 indicators we selected, included in our survey, but we didn't include individual level indicators. That's because we are contributing to a study in WISE, so together with other organizations. So this NYS study is Southwestern University as well as UNC. So the indicators that are asked there in NYS are very much similar to the individual level indicators. So that's why it is kind of discovering in that part. So in terms of the schools, the survey is done in 300 schools from 9 different countries. And actually we are working in 10 countries in the schools. Madagascar, Mozambique. Mozambique we have also received data from 10 schools now. In that sense, it's 10 countries, altogether 310 schools. The data is in our list. But what I'm going to present here is basically the outcomes of 138 schools from 6 countries, because it's still ongoing, the analysis part, you know. So, and Nepal, the 6th country, as you see here, there are 8 schools basically in Nepal. So of those 8, 6 are carried over from phase 3. Therefore, the result will be a bit kind of, oh, so nice, something like that. But most of them are carried over from the earlier phase. So the result, if we look at those 4, against those 4 indicators, the basic sanitation, private space with water and soap, emergency MS materials, availability of, and education from age of 9 years. Overall, we can say like the education part, though it is progressing well, I would say, but when it comes to the age of 9, we can see here from 6 countries, with 38 schools. I mean, it's really the area that we need to put more and more effort, you know. By saying we, it's not only we, the authorities who are there to make policies, and you know. So it's very important to do advocacy on that aspect. Then at the same time, when we look at the private space with availability of soap and water and soap, you see the situation is not that good, because 3 countries is nil, and others also little bit, you know. So the thing is, this is another equally important area to put more and more effort, you know. And from the records, we saw that of these 138 schools, only 25% schools are getting kind of dedicated MS budget. That is also from the local government institutions. So the remaining ones, they are fully dependent on communities, or let's say parents. So that is the situation at the ground level. So without budget, we cannot just, you know, think of fulfilling this. If I go country by country, like Niger, against all 4 indicators, it's nil. The baseline is nil. Burkina Faso, private space with water and soap, that's nil. Same is with education from age 9 onwards. Cambodia, again similar like with Burkina Faso. When you talk about private space, data is nil, and emergency MS materials. Out of 25 schools, in 1 school they saw some emergency material is there, but 24 schools, it was nothing there, you know. So that comes 4%. And Nepal, as I said before, I mean, since 6 out of 8 schools are carried over from phase 3, you see some areas very good result, but when it comes to education, MS education, from the age 9, again, this is challenging. Needs to be done something really rigorously. Otherwise, it will be a difficult situation. Similarly, South Sudan, yes, 10 schools. At least 1 school is fulfilling all 4 criteria out of 10, something like that. And Ethiopia is a bit better. But still, I mean, in terms of amateur education, if you see, in Ethiopia, more than 90% of schools, they have started already an amateur education. But when it comes to the age 9, it's only 4%. And that's where, you know, and the age 9 is something. So, and then also, if you see MS materials, 45% is schools. This is very interesting data. 94% schools, they have kind of exclusively responsible teachers for MH. And those teachers are also trained anyway. But material, we see only in 45%, even though that is there, you know. So these data are so interesting. I mean, we can, like private space in Ethiopia. So private space, the record shows 50% of schools, they do have private space. But here, with water and soap, it's only 19%, less than half. Though you have private space, but you don't have water or soap. Something is, of course, missing all the time. So, yeah. This is how is the situation, scenario. But one good thing that we consider as a success point, like, you know, in Ethiopia, the student clubs, they are very active. They go to the community with this kind of different, you know, campaigns, but the campaign on this MH, they have been able in one community to change the name. Menstruation used to be termed as monthly dirt in that particular community. So these students were able to change that monthly dirt into monthly flower. So, I mean, this is sometimes such things inspires you. This is what I should mention. But looking at this table, all this data, what is here then? The next. Very strong advocacy is needed in different fronts. Like, for instance, like how to start education from age 9 in schools. We definitely need very strong advocacy on that. And how to improve access to infrastructure. That needs budget, dedicated budget. As I said, only in 25% of schools we saw. Rest 75%, there is no budget from like government authorities, government level. So there also we need very kind of strong advocacy. Then regarding MSS materials, how to make available, maybe through capacity building, maybe through some introducing some sort of business models in rural areas. So could be some other ways to address that, and eventually integrating this monitoring into national system. That also will require strong advocacy. So with this, maybe I will take you back to my first slide. Yeah. As I pronounced capacity building, this is one example. Friends are here who can read Nepali also. This is from one school in Nepal. Dorpa is the district. It's a very remote district. But you see the school. Students, both boys, girls, and then teachers, male, female, they are taking training how to make reusable sanitary pads. Because it's a very far remote area, and then even if you would like to buy sanitary pads, you don't get it in the market. So you have to know something. So capacity building also maybe can start from such initiatives, which will definitely be useful at some point. Thank you very much.
Thank you Ramesh. We are quite behind, but we have some wiggle room later in the schedule, so we have time for a few questions. For any of our speakers, Marnie, Tom, Mariah, Therese, or Ramesh, if you have questions, there's the microphone in the back so people online can hear you. Everything is just so clear.
Can I ask a question without going over?
Yes, absolutely. I'll repeat it for you. Yes, I don't blame you.
So all of the data seems to have come from low and middle income countries. Do we think it's important to also be collecting the data from high income countries? And if so, how do we ensure that we do that?
So much of the data is from low and middle income countries. Should we be collecting from high income countries, and how would we do that? That would be a good question for Tom, probably. Yeah, and we do have, thanks to Rick, a microphone.
Yeah, great question. I think that's true of the data for Washington households. So the majority of the data in our report is from lower middle income countries. But when it comes to schools and also to healthcare facilities, we do have quite a lot of data for upper middle and also for high income. One of the challenges in high income countries is there are fewer household surveys, or they are organised differently, and so the opportunities to collect information on individual women and girls, for example, are fewer. But certainly, that is an area that we could think about and see if there are alternative ways of collecting that information. There are some examples that we've highlighted in our reports of information that's been collected through sort of phone surveys or big studies which have tried to capture information that's not coming through government systems. But I think that your point is well taken.
And over here, just walk these around.
Thanks very much. I'm interested in I can appreciate the focus on adolescent girls in school, but it would just be really good to hear about what is the proportion of adolescent girls who are not in school, and are we missing something by not? But because we're not covering them, and also, adolescent girls in school, that might be, 5 years out of 35, 40 years of women who menstruate. So what I appreciate that in the household surveys for JMP that households menstruation is included, but just in the other surveys, are we missing something really important here if we're not looking at that as well?
Maybe one more question. Perfect.
Mine is a little bit related. So I heard Therese mention that potentially there needs to be more advocacy with the health sector, and I work in sexual and reproductive health, so that could be a way to reach out of school adolescents. So I was just wondering, currently it seems like in health facilities you collect data on facilities only, but is there potentially a place to collect information on how people are receiving information and being counseled on menstrual disorders in health facilities?
If there's one more, we could take one more and then we'll hand over. So far, those sound like Tom questions, but
Thank you. So I had a question about the indicators. So there is a list of 21 different indicators, which is great. And you also mentioned that it's important to have some priorities based on what the stakeholders need. So now if you're going to have different priorities depending on the geographic context, how are you going to compare progress across countries? Is there any recommendation for that?
excellent question. And maybe we'll take one more because I saw my student's hand up and I'm partial.
Yeah, you mentioned over here a question about adolescent girls in schools, but I'm also curious about the education for boys and men in schools and how that impacts the social scene in the country, and the culture, and the policies that are being implemented. I don't know if there's any work being done on monitoring that or plans for it, because I'm sure it's still kind of in its infancy.
Great, and that may be a Mariah, Marnie, or Therese question. Mariah, yeah, perfect. So I'll hand to Tom and then Mariah for the last question.
Yeah, very good question. So on the adolescent girls who are not in school, that's a real gap. If you're relying on school surveys, you're going to be missing a large chunk of the population in some countries. So I think that means you need both information on individuals, which is collected outside of the schools, information on schools, to be able to triangulate. The other challenge that I think was highlighted is that the information on individuals tends to be for women and girls aged 15 to 49. Now, conceptually and in many ways, you are going to be capturing the problem if you're talking to that age group. But there may be significant differences for younger age girls who are menstruating, which are not captured through those surveys. So those can only really be captured through targeted surveys for those age groups, which could be through a school, or it could be through other mechanisms. But that's another significant gap in the data. And then on the 21 indicators, so the idea is we standardise the indicators, and then countries can pick and choose from those standard indicators, and we will compare on the basis of standardised indicators. But of course, we can only compare the ones which are collected. And for us, it's really important to have data at the national level. So there's a lot of great examples of data that have been collected in one or two districts, or maybe they've been collected just in the rural areas or just in the urban areas. So for us to be able to compare globally, internationally, we need to have data that are representative of the national, and that is often a challenge in the data sets that we receive. So what we try to do is we produce internationally comparable estimates for the indicators which are representative at the national level. And then we will highlight examples of data that have been collected on a small scale if we think they're interesting and could potentially be scaled up. But we try to make a clear difference between those two types of information, because one is going to be comparable, the other is going to be only really representative of the areas where it's been tried. But the other was definitely a Marnie question, I think, on educating men and boys. Oh, you're going to take that? Yep.
Since Mariah's in the room, I'm sure Marty can answer that as well, but it's a great team of
Thanks. Yeah, and if anyone online wants to add, please feel free. But just to say, yes, absolutely, we need to educate boys and men. And I think the great thing about the priority indicators is not that we're asking if girls were educated, but if students were educated. So we need to ensure that also boys learn about menstruation in schools. And how we do that, it depends on the context. Sometimes boys and girls will be in the same classroom and they're comfortable and they're okay. But sometimes maybe we separate them for a conversation so that girls also feel safe and talk about things that bother them or questions that they have, right? So it really depends on the context, but we try and measure students learning about menstruation. And then I think the other very interesting indicator here in this list is about girls who have someone they feel comfortable asking for support. And that could be a father, that could be a male teacher, who knows. But again, it is really about a girl feeling comfortable and she has a supportive environment. And I think having these two questions can give us some understanding about breaking taboos, and men and boys are a part of that.
Thank you so much. Let's give another round of applause for all of our presenters. Thank you so much for making the time. Let's talk to each other. So I'm going to hand it over to Rick, and he'll walk us through the breakout activity.
Thanks. We wanted to have at least a little bit of time to sit and discuss amongst ourselves. This is a terrible room for it, so we're going to ask you to just turn around and face your neighbors and make groups of 5 or 10 or whatever works out well. But we've circulated a list of both the 21 core indicators that Marty presented, and on the backside, a number of additional indicators. There's the big 7 that Tom presented, but also a few other indicators. We want you to reflect on the session today and think about, well, what are the key actions and actors needed to improve national and global MH monitoring with a view on opportunities for translating data into action. You know, they say what gets monitored gets done. That's not true, okay? There's a lot of stuff. I think you can say what doesn't get monitored doesn't get done. I'm okay with that. But there's a lot of things that get monitored and the data never get actioned. So how can we find opportunities to translate those monitoring initiatives into action at scale? And we saw some nice examples through our previous presenters. So please, in your groups, take a look at the list, reflect on what you yourself have already been doing, and maybe think about what you could be doing following this session when you go back to your day job, wherever that is, and what types of resources might be available or you might need to support you in those actions. So let's take, 8 minutes to do this, and then we'll have some selected feedback.
Just to listen, not to facilitate.
Stop. I know we're using them any strong. It seems like the alternative is like, are you using some form of anything at all, or are you just free cleaning? I would make the most with something to shove in there, which then qualifies. So I heard that shows like everyone has something. Is there any?
Yeah, thank you so much for that. That's specific to like, we're working with anything.
Like I talked
we've been
there is a list of
helping funding
surveys of collected very detailed information on exactly what and then there are certain things
folks have got it, or have been donors, to make sure that it's
so they don't. And then nothing at all doesn't happen.
It is. I just sorry to
They're also okay, so there are there is a list that is typically asked, but it can be kind of nothing in that list then does get counted as it's all focused implementation.
And the experts were very clear on this. There shouldn't be a hierarchy from health
we just don't have high
It's like in Australia, we've had this big bloody survey that was done by one of the NGOs, and it's completed now.
I was thinking, like, wouldn't it
Which I've read and just haven't memorized.
That's what currently in Australia. So using these indicators, I think in high-income countries would be really.
I don't have a card either. I'm glad you don't, so that I don't feel like such a turkey. I'm in some transition.
Oh, just like the way that it's raised, like you don't not getting reliable responses. You're asking things so everybody who's responding to this is in school.
Yeah.
Throughout the whole life.
I've been
It's really heading in nice.
So like I'm
how bad it was.
yeah. So anyway, so I'm here with my charity and
To like this many what they're saying, this many
yes, and I feel
Not
bad.
that interesting already to you.
design your study in a way that you can set stuff, but currently it's the best that it has.
And I was afraid to see this stuff I couldn't find.
There's a lack of reliable data.
There won't be any.
Make some, putting in some wells and some super.
NGOs we shared some of this.
I mean, yeah, I think about having kids that were like this information at a local level.
I think they had academic inputs
Like national,
but like any of them academics who were involved or activists or academics.
I will. People ask
They
kind of
didn't necessarily know the
learn absolutely. I feel like we get educators
We have a look at
and you're pushing
Session.
ramping this up.
I think happened in Australia had been actually not even policy. They were more national than a national. Governments are now providing free
Start with local materials interest in some way because
I don't think that's a national thing.
monitoring.
I'm curious what you all think about
The survey results
like
have really been
in schools how the development prevention if you are using these indicators, it's almost like they didn't then be harmed to but also if you're using it and you identify a real problem, can be kind of a proof of concept as it were for like, well, we should be monitoring this because look what we found when we actually bothered asking the question. So having it at this point.
It says it will be perfect use to
Especially with phones.
There's a lot of interest, not like understanding how to capture this or what are the important aspects to capture. Like most of my work on menstrual hygiene and health is in the US, and I would say like even our language around what is needed. I think it's just like there's no word here. You're saying that exists, right? When I'm working with like departments of education and things like that, like they're focused on like menstrual material and comfort, and that list is always short. Like it's that is like necessary. I feel like products
This is not just the US, or it is relevant?
It is relevant. Exactly. Yeah. I think it's relevant. The US is not. We don't have this. We are not meeting all of these. Monitoring in the US and other high-income countries, I think, would show that like we are.
Take about 2 more minutes, and think if there's a reflection that you'd like to share back with the group.
Probably not meeting comfort disorders, supportive social environment,
and I feel like that's
knowledge.
You're around the world in terms of that's why they're not going to school. We don't have the data to show that. So many reasons to try to
It's one of the right?
They went around.
So, I definitely where I live in nobody loves to supervise as well, like all the other times.
The second one is also
Shot that girl's
interesting too because it's uncomfortable. That could change on the
like with how that you just expanded girls into the field and different accommodation there. And that's why we're only teaching environments. Many countries across these areas.
That's what I find this one too interesting. Why? But it's a environment. These ones are just so fluid. Monitoring the
so like there's like when we have Emory, usually knowledge and I think it was interesting. I think it kind of
it's true also in development that is so involved with
I also predominantly every session is actually done under the tropical tea conference in school going on like fasting and how it's so
The second question I think is really interesting because menstruation is something that's already so in space. So like any kind of actual use,
tiny. So they just started to.
Anyway, I look forward to with you in the next 2 weeks.
I found something interesting in Australia.
Suddenly there's so many women who have more childhood who are perimenopausal or postmenopausal. That's getting a lot more traction. And I'm kind of hoping that we can get menstrual health talk into that, right? And I understand that in a lot of countries it is still very patriarchal and things, but I wonder how much, as we power around the world,
I think like some of this but like in that village kind of like puberty, like this is what the doing is. I mean, there's really like things but not intentional. Right. So then you have the watch people that really focus on management and like the healthy beach.
Okay, with apologies for truncating your vibrant discussions, we need to wrap things up. We've got a couple minutes to share feedback though, and I see also that online there's been a vibrant discussion, so we'd like to get some feedback from our online partners. I will just walk around, and when someone puts their hand up and says they have something interesting to share, I will give them the microphone so they can share it. We've got just a few minutes for that, so I am looking for volunteers. Don't be shy. No taboos here. Oh, I see someone being volunteered. No, she's not volunteering. Okay, no, that's okay. We no pressure. If anyone. Okay, I see a couple hands over on this side.
I did. I threw you under the bus.
All right, I'll go with you and then.
I know Rick for the color. Sorry about that.
Okay, so for our discussion, we had a lot of experience from colleagues from Nepal and India, and all over. So for mainly indicator 1, we were like, what are the sources of the hygiene materials? Where are they coming from? What materials are being used, and what's the sustainability? We also talked about the fact that knowledge on menopause is missing. Like in the life cycle of menstrual hygiene or menstruation, you can't really complete the discussion without talking about menopause. And so many people, men, women, and boys and girls have little knowledge on what menopause is, and it comes as a shock to them. So we have to complete the knowledge with that. And also opportunities to involve older generations in the conversations on menstrual hygiene through community outreach, because some mothers in some countries don't even want to talk to their daughters about it, so then that's an issue. And we also more attention on a functional and clean facility, as well as access to water during monitoring. Yes, it is clean, but is it functional? Or okay, it's functional, but is it that clean? And do they even have access to water as well? So those are the things that we thought there should be more attention on. Thank you.
Great, I love the point about menopause, and it's a topic that doesn't get discussed as much as it should. Lauren?
Thank you. So we were discussing political will and how kind of MHH has fallen off agendas sometimes, or kind of it takes some effort to keep it on the agenda. So we were thinking about indicators that were quite useful within this list, and it was talking about the kind of government national, like I think it's 14, 20 and 21, because it's not primary data collection that's necessarily needed to look at those indicators. You can look at documents and document review to see how MHA is kept on the agenda, and especially with 20 and 21, looking at the financial allocation that is there, right? MHH isn't going to happen unless there's a financial allocation in a budget. So from a systems lens as well, you can look into the system and say, is there financial allocation for this? And accordingly, frameworks that enact them. So it's quite useful to keep those indicators, but don't necessarily have to be primary data collection and very costly.
It's a great point, and the JMP reports tend to focus more on outputs and outcomes, but there are other initiatives like GLASS that look more at the enabling environment and would touch upon like those indicators 14, 20, and 21. Coming over to this side of the room, I see 2 hands up. Excellent.
Thank you. So in our group, we discussed about how hard or how easy it can be to collect data, which will define whether these indicators are relevant to a specific country. So again, to answer this first question, it will be country specific, and it is important to, of course, gather with stakeholders and then understand the impact versus difficulty to determine, which indicators to track. Now, while, the domains of materials, wash, and knowledge are very straightforward, tangible. We discussed also the fact that discomfort and disorders are very subjective, and then it can change from one day to another. It can change, throughout the day. So having a subjective indicator might not necessarily be, the easiest, because again, it's very hard to track on that. We also discussed about the policy domain, which is interesting because it's very easy to monitor. And it can have actually a long-lasting impact, especially in the wash space.
Great. Echoing the comment about how monitoring policy type issues is very different from monitoring individual or school type issues. Easier maybe, but not trivial either. Okay, I see a hand up here.
Yeah, in our group we discussed about how difficult it will be to monitor some of these questions and ask them because they're so personal. And I think Lee was saying how in her work it's normally coming from the school boards that are giving the data, and that's quite hard for them to answer when these questions are so personal. So we're talking about different ways we could get around this, perhaps by doing anonymous surveys using apps or something like this. And then another point that we didn't quite make that I wanted to was what language can we use to make sure trans and non-binary people that menstruate are not excluded from the data collection as well?
Mm-hmm. No, those are great points. I think especially the capturing the non-binary voices is challenging, but can be really revealing. In our households report, we looked for such data. We found very few, but we did find some from the US actually, which showed big gaps in service levels. I think from our online group, we also have some discussion. And Therese, could you share with us how that discussion's been going?
Yeah, thanks. So there was one really key point around how it's very important that we have monitoring and data available at the local level so that it's really informing decision making where things happen. So not just collecting data and having that national picture, but disaggregating it by regions, by locations, and making that data available closer to the ground for things to happen, but also whilst we might only collect very select data at the national level, if programs or research include these indicators alongside more detailed monitoring tools, that can help us to really understand what's happening underneath data. So, for example, we've got indicators about girls have sufficient materials, but also more detailed monitoring could look at, are they their preferred materials? Are they affordable? And all of that sort of thing. So really important if we look at multiple mixed method monitoring, but have this harmonization across them.
Thanks so much, Therese. Yeah, there's kind of a continuum of monitoring, really, where you can really dive deep and get into mixed methods and very sophisticated work. Then you can also have very lighter touch monitoring, whether it's at the program or like a national scale. So I think you can kind of triangulate with information from all those different types of data sources. I think our time is up, so I'm going to pass over to Maria to wrap up and conclude and call us all to action.
Thank you, Rick, and thank you everyone for your active participation in the discussion today. I think we had a great session. We got more familiar with the priority indicators for girls. which also includes boys, which is something that we've learned. And we saw the latest data from the JMP, and then also looked at some lessons learned of implementing these indicators at the country level and even at the project level. So I think some of the key takeaways for me is how can we make this even more inclusive? You mentioned already trans, non-binary people. How do we, how do we include them in this data collection process? But also out of school girls, schools below 15. So I think it's really something to think about further. How do we include other issues like menopause, or even further focus on PMS, endometriosis? We have questions about discomfort already, but how can we bring that out more? The other thing I wanted to say is we had the expectation or the hope that you would be inspired by today's session. I definitely am inspired. We said what gets monitored gets done, or maybe not. I believe what has a global goal gets done. And that is very clear from the data. We have 165 or 156 countries that have data on basic sanitation in schools, but all the other indicators, there's hardly any data out there. And it is because we are supposed to measure basic sanitation because it's part of the SDGs. But we know that MHH is really, really critical to achieve all the SDGs, and yet there is no global target, there is no indicator, nothing. So can we together start monitoring menstrual health and hygiene and make the case that we really need a global goal, a global indicator, so that it drives action? Because so far we are far off from making sure that all menstruators' needs are met. All right, so don't forget to leave your, to take your reports. They are here at both sides of the room. The JMP is not going to take them back, so please bring some extra copies for your mother, father, grandmother. And last but not least, there's 2 sessions coming up. There's a session this afternoon at 1:30 in Azalea. And Marnie Summer and Columbia University Millman School of Public Health is launching the menstrual-friendly public toilet toolkit. So please go there. And then on Friday, I think in the room they also have April Ballard from Georgia State University, if you're still here. Yes. So you have a session on Friday where you use the indicator domains as a review framework to look at menstrual health state policies in the US. So those of you interested in menstrual health in the US, please join the Friday session at 2:45. So I'll leave you there. Thank you so much for participating and being here today. Thank you.
Oh, I don't think we've actually met in person. I know of you.
So good, I'm done.
So I celebrate. She wrote was a big review and developed the menstrual model for low symptom women, and then I led the one for high
Sorry.
I'm very passionate about getting
Bethany is like normal residency visa.
Indicators of high quality testing.
Exactly. Anyway, she got like visa.
I worked on there like healthy and low income people, but I moved back to Australia actually about the same time that Julie did. Her doctor said, do not trust the fact that in Australia just throw pads at the problem. Yeah, which is like I think about experiences beyond that.
I did, yes. Yeah. I didn't get it yet. I'm sorry. It's okay. Might.
I found this